do is take a few minutes and tell you a little bit about what the Center for Occupational and Environmental Medicine has been doing with patients with this disorder of psoriasis. So number one, I want to let you understand that this is a disease not only of skin, but affects very severely, especially the joints, the muscles, and sometimes the GI tract. If you look at the latest edition of the pathology textbook, it will tell you that the antigen which causes this disease is still elusive, that they haven't identified where it is. Well, today I'd like to tell you that at the Center for Occupational and Environmental Medicine, we know what that elusive antigen is. And it begins with a story of the famous allergist, Dr. Dorr Brown from Texas, who was giving a lecture, and he said to all of us physicians, "I am sure that all of you have noticed that when you treat your patients with Trichophyton and Epidermophyton, their psoriasis clears." Well, I almost fell off the chair when I heard him say that, and I actually asked him to repeat that during a discussion period. So we do now know what that elusive antigen is, and that antigen is a fungi, which is called Trichophyton and Epidermophyton, or for short, TE. And we test patients using that particular antigen with really dramatic results. In addition to neutralizing the patients to this particular fungus, we found a cocktail which is important for reducing the body burden of the fungi, which we now identify as the actual trigger. In addition, God gave us that wonderful sun, and for those who have ever traveled to the state of Israel and visited the Dead Sea, you would have noticed that the water is full of people with the disease of psoriasis, and that is because they think there is something magical about the Dead Sea salt water. But in reality, it is really not the water, it's the sun. And sun produces vitamin D. So in addition to the neutralization of this elusive antigen, which we now know what it is, we also encourage our patients to use relatively large doses of vitamin D in order to clear their psoriasis. So in putting this all together, psoriasis is a disease that everybody thinks is skin, but it's more than skin deep. If you have psoriatic arthritis, you have an autoimmune disease which attacks also your joints. The Center for Occupational and Environmental Medicine for over 41 years has specialized in autoimmune diseases which are triggered by environmental triggers. And part of the environmental trigger are bacteria and fungi. So I would encourage anybody who has this disorder, or know people who do have it, if you would like to have them call the center, we'd be delighted to share the information which I'm giving you today as a very effective way, safe way to treat this horrible disorder. Thank you.